All right, hello everyone. I'm Kendall Doyle.
And I'm Danielle Hazeltine, and we're both doctoral students in the Health Psychology and Clinical Science program, and we're also clinical fellows here at the GC Wellness Center. We recently facilitated a workshop called Supporting Those Coping with Chronic Illness, How to Take Care of Yourself While You're Taking Care of Others.
So this workshop aimed to provide support for those students and connect them with others who are also caring for loved ones with illness, and also to help students learn some self-care strategies that they can enact daily or during times of stress. So we know that wearing multiple hats, such as student and caregiver, can be associated with many stressors and challenges, some of which include challenges with enacting self-care, such as maintaining good sleep hygiene, or managing overwhelming emotions in the moment. So the goal here is just to kind of give an overview of some tips and tricks that we discuss with students who are caring for others coping with illness. And we know that self-care often kind of falls to the wayside when we're stressed, and one place that tends to show up is in the area of sleep. So Danielle, I'm wondering if you can tell us some strategies to help students improve sleep when they're coping with a stressor such as this.
Yeah, sleep troubles are so common with caregivers. There are many ways that we can help improve our sleep habits. One thing, and there's the question of, well, what's so important about sleep, right? But when we don't sleep enough, we put ourselves at risk of acquiring long-term health conditions like anxiety, depression, chronic pain, compromised immunity, and we also experience immediate negative consequences like poor concentration, irritability, forgetfulness. And it can be hard to maintain healthy sleep habits when we are stuck in our homes all day as a result of quarantining or when our stress levels are increased. So as a result, many are struggling with sleep issues.
Yeah, so what are some sleep hygiene tips and techniques that you can employ daily or when you're having trouble falling or staying asleep?
So during times of stress, our sleep is often negatively affected, and we're inclined to sleep more or nap during the day, or we're unable to fall asleep or maintain a sleep schedule. If you are experiencing these types of issues, there are some behavioral strategies that we know to help improve our sleep. One strategy can be to get your body back on a sleep schedule by waking up at the same time every day, even on weekends. And this may be tricky. You may be inclined to sleep in on mornings where you had trouble falling asleep at night, but actually maintaining a regular sleep schedule is a great way to help your body get back on an internal clock or the circadian rhythm that helps you relax and fall asleep when you should.
Thank you. What about electronics? How does that impact sleep at all?
Yeah, great question. It's helpful to limit evening screen time, especially before bed. And this is another strategy to help regulate your body's internal clock, because the blue light from the screens actually increases our alertness and works to suppress the production of sleep hormones because it mimics the light from the sun. Besides increasing your alertness at a time when you should be getting sleepy, which in turn delays your bedtime, using a device with a screen before turning in delays the onset of REM sleep, reduces the total amount of REM, and just overall adds to this cycle. So it's beneficial to have a regular unplugged time in which you avoid all screens, TV, phone, iPad, 1 hour before bed.
Okay, so then would you recommend maybe like a bedtime routine?
Great question, right? Because there's the question of, well, what do I do for that 1 hour before bed if I am not on my phone or watching TV? And there are a lot of things that people can do to help them relax and tell their mind and their body that it's time to go to bed. Some people take a hot shower, warm bath, maybe they do some stretching, put on some calm music, do some deep breathing exercises, light some relaxing candles. The list goes on and on. Another thing is that is helpful is to limit your bedroom activities just for sleeping activities. And this will help tell our brain that bed is for sleeping and bedroom is for when it's time to go to sleep. Um, and then to then do all your daytime activities, daytime relaxing, homework, attending classes, um, on a chair at your desk, um, anywhere else that's not on your bed.
Okay. So what do you recommend if someone is trying really hard to fall asleep, but they just can't?
Great question. Right. If you are having trouble falling asleep, say you're lying in bed looking at the ceiling, um, kind of along these same lines, you should relocate to a different room if possible. Within that same kind of thought process that we we should only do things in our bed that is sleeping.
Mhm.
So if you're lying in bed, you can't sleep, it's best to get up and relocate to a different room if possible. And until you start to feel sleepy, and then get back into bed
Mhm.
and repeat this process until you do fall asleep.
Okay.
Yeah. And there
And
are many more ways to improve our sleep, but those are the big ones.
mhm.
And now that we've talked about kind of what to do when we want to go to sleep, maybe Kendall, you can talk about some strategies while we're awake.
Yeah, for sure. So, a lot of the strategies we discuss in the workshop really kind of focus on mindfulness activities. So, countless studies and research have linked mindfulness to better health, lower anxiety, and greater resilience when it comes to stress. And when we think of mindfulness, we tend to think of, those big activities like meditation or yoga, but mindfulness can really, be much more simple and easier to do than just meditation and yoga, because mindfulness is really the basic human ability to be fully present and aware of where we are and what we're doing, and not to be overly reactive or overwhelmed by what's going on around us. So typically, mindfulness focuses on the present moment. Specifically, we pay careful attention to what we're thinking, feeling, sensing in the present moment without judging those thoughts and feelings, whether they're good, bad, or anything in between. And this may kind of seem way easier said than done because, when we're having high levels of stress, we kind of often veer away from the current moment and our mind takes flight and we lose touch with our body. And pretty soon we're just kind of in a worry hole thinking about, a stressful thing that just happened or fretting about the future. And that can make us more stressed and anxious, and it can be hard to get out of that. But when we're mindful, we direct our attention to how things are rather than how we would like them to be. And mindfulness really encourages us to try and stop worrying and make the worries a little less scary when they do come up.
Yeah, I really see how that could be helpful. So, what are some mindfulness techniques that we can practice when we start to feel stressed with the pressure of caregiving?
Yeah, so one technique that's really helpful, especially for students, individuals who aren't familiar or comfortable with mindfulness activities, is called the five senses exercise. And this is great because we use our five senses, sight, touch, sound, smell, and taste, as a guide to bring us in, ground us in the present moment, and kind of bring more mindful awareness to what's going on around us. So, to perform this exercise, like I said, you use your five senses. And the first step is to look around your immediate environment and bring your attention to five things you can see. And you want to pick something that you don't normally notice, like a shadow or a small crack on the wall. And then once you've identified five sights, next you shift your focus to four things you can feel or touch. This may, be like something in your immediate vicinity, like the texture of your pants, the breeze coming in from an open window, your feet on the floor, smooth surface of your table, your desk. And then once you've identified four things you can touch, you take a moment to listen and try to note three things that you can hear in the background. So this can be, a chirp of a bird, the hum of your computer, faint sounds of traffic, whatever kind of comes up for you. And then you want to try and identify two things you can smell. So bring your awareness to smells that you usually filter out, whether they're pleasant or unpleasant. Perhaps you someone's cooking in your home at the moment you're practicing this exercise. Maybe you have a candle lit or a window open. You can smell some scents outside. Let's say there's nothing, that's a strong scent around you. You can always bring your imagination to scents that you really love and bring you comfort, maybe like the scent of the ocean or your favorite flower. And then finally, when you're able to identify two things you can smell, you want to move on to taste and try to observe one thing you can taste. So you may want to focus on, a sip of your coffee. Maybe you're chewing gum or enjoying breakfast, and you want to just put all your attention into that taste. Let's say you don't have anything to taste at hand. You may want to focus your imagination on one of your favorite tastes, like your favorite dessert or fruit, what have you. And this mindfulness exercise can be practiced quickly and easily and anywhere or anytime and pretty discreetly too.
Yeah, that sounds great. It also sounds like a good activity for, the 1 hour routine before bed.
Yeah, that's actually a great idea.
And I know there are some other exercises. So what's another one that students can use when they're feeling overwhelmed with negative emotions or stress?
Yeah. Another exercise we talked about in our workshop was a helpful mindful breathing exercise, specifically diaphragmatic breathing, which is also known as belly breathing. And so belly breathing helps our body kickstart our parasympathetic nervous system, and that's responsible for rest and relaxation. So it can be thought of as like a biohacking technique. If you're feeling very, very overwhelmed and anxious, that's when your sympathetic nervous system takes charge, and you want to try to turn on the other part of your nervous system to try to bring down arousal and promote relaxation. So, very simply, the goal of this breathing exercise is to breathe more through your belly and your chest. So, to practice this exercise, it's helpful to put one hand on your belly, kind of right above your belly button and right underneath your ribs. And then the other hand you want to bring on your chest, kind of right above your heart. And as you breathe in, you want to make sure that the hand on your belly is moving more than the one on your chest. So as you breathe in, you're going to breathe in slowly through your nose so that your stomach moves out against your hand. You want to think about filling up your belly like a balloon, and the hand in your chest, again, should try to remain as still as possible. And as you exhale, you want to exhale through your pursed lips as if you're trying to whistle, like. And as you do this, you want to tighten your stomach muscles to push out all the air from your belly. Think about pulling in your belly button towards your spine and contracting those muscles. And the hand on the upper chest, again, should remain as still as possible. Sometimes it's really helpful to count while doing this exercise. So you can count to 4 as you inhale. You want to hold your breath for a count of 2, and then count to 5 or 6 as you slowly exhale out of your mouth. And you may want to adjust the counting based on what's right for you and what feels most comfortable. But the key is you want to make sure that you're breathing out slower than you're breathing in. So the exhale count should always be higher than the inhale count. And this type of breathing is, kind of a new exercise for many people. So keep in mind, it's going to feel uncomfortable at first. It may feel most comfortable when you're practicing laying down with your legs bent. But as you get used to it, the easier it gets. And of course, these are just some few mindfulness exercises, certainly not all, but a great starting point for people struggling with stress of school and also, caring for a loved one with chronic illness.
Thanks, Kendall. And
Yeah.
then finally, I just wanted to remind everyone that these are some, of course, really helpful strategies. And also the Wellness Center has so many different opportunities to get support in whatever aspect that you need it. There's individual counseling, support groups, referral services, amongst others.
Yes. And remember, you can't take care of others if you're not taking care of yourself. So make sure to prioritize your health too.